OSI stands for Online Support and Intervention, and it's a digitally augmented psychological therapy. So that means essentially we're using digital to really enable us to deliver a psychological therapy in ways that might come with more, accessibility, can be engaging, and particularly increase access. So parents access online modules that introduce them to the core therapeutic content, give them things to try out with their children to help their children to overcome their problems with anxiety. The parent is supported by a therapist remotely, typically over the phone, who after they've worked through each module will have a call with them and kind of coach them through it, help them think about any challenges they might have faced and how to address those, help them think about their next steps and really try and deepen the learning, both that their child's had and that they've had as well. The feedback that we have from parents is very positive, and actually they get to learn the therapeutic strategies, they get to implement them, and they feel very supported by the therapist, even though they are just having these remote calls. I think part of that is that it can really fit around families' lives, and they really value that, but also we collect data within the platform, so we can learn a huge amount as we go. And one of the things we collect data is their satisfaction with the therapist calls that they have, and we find really high levels of satisfaction that are exactly the same as what we get when we ask the same questions following more traditional approaches. So despite the fact that they are brief and they are remote, families seem to feel supported by them, they seem to feel they have a connection with their therapist. And we do a lot of qualitative work to understand people's experiences, and that connection and support from the therapist is the thing that is probably emphasised the most of all, which is quite incredible because, they have overall, 20 minutes once a week for 2 months, and that's it. So it's not a lot of time, but people clearly establish, really supportive relationships very quickly. So we definitely have had a sort of continuing involvement of children and parents and carers and also clinicians. So there was very extensive co-design right from the beginning as we developed the programme, and then through the evaluations, when you're doing the evaluation you kind of have to keep it the same, you can't start messing about with it then, but there at those stages we really made sure we were involving families in the research studies to make sure we were asking the questions that were most important to them, asking them in ways that would work for them, and really working with them to look at the data and think about what the implications are from their point of view. So involving families then. And then now we're in a position where we're working with a partner company to roll the platform out beyond research, and they're in a continual process with us. We look together at the data and we're evaluating it all the time. We're coming up with ideas for enhancements. They're regularly testing those, particularly with clinicians. And actually, it's a nice stage to be at, because when we're doing the trials, we can't really change anything, even if we see something we would like to change. Whereas now, we can just have this continual process responding to the feedback that we're getting. Typically from parents, that comes within the platform, because we can, as I said, collect a lot of data, but there's a lot of conversations with the clinicians that are working with families too, to make sure we don't lose their perspectives on it. So the original programme was developed specifically for children, pre-adolescent children with anxiety problems, to be delivered through the NHS. And so that's starting to expand already to think beyond the NHS to other settings globally. But keeping our focus also very firmly on the NHS, it became clear from clinicians that we were working with that there were areas that they felt that this model could be helpful. So one of the areas that we've moved a long way ahead on is specifically still anxiety problems, but anxiety problems for autistic children. That's where guidelines recommend that treatments really should be specifically adapted to meet the needs of autistic children. And we did some really nice work with colleagues to look at how the programme needed to change to meet the needs of those families. And we're now doing a large NIHR-funded study evaluating that new OSI autism version in CAM services. So there's a sort of one example of a spin-out, still anxiety version. We have some funding from the Medical Research Council to also evaluate a version specifically for children with obsessive compulsive disorder. And we've also got some funding as part of a new research centre that we're now setting up to also look at behavioural problems in children and how we can support parents of children with behavioural problems problems. We're now working with a commercial company called COA Health, and we spent a lot of time really thinking carefully about what is the best model to take this forward. So I think, my original dream was that we would develop this and we would just hand it over to the NHS and they would just use it. But it became very clear it doesn't work like that. And essentially it does need a vehicle for ongoing investment in the programme and to provide the support that's needed to keep it up to date, to keep improving and enhancing it, and to make sure the training and supervision that services require is provided as well.